Hi everyone. In July of 2025, our very respected and tireless sexual medicine experts, Drs. Marty McCary, Drs. Heather Hirsch, Barbara Levy, Rachel Rubin, Ashley Winter, Kelly Casperson, James Simon, and Roberta Brinton, headed to the FDA with the specific intent to remove the boxed warning label on vaginal estrogen. For those who do not know, the label on vaginal estrogen is actually that of systemic estrogen, which is completely different than vaginal estrogen. Vaginal estrogen treats hormonal deficiencies in the vulvovaginal area. And without the treatment of vaginal estrogen, these hormonal deficiencies can actually ruin our workspace as pelvic rehab providers. The FDA is accepting comments from the public until September 24th, and I'd like to share with you now the letter I shared with them this past Sunday. My name is Stephanie Prendergast. I am a pelvic floor physical therapist and co-founder of the Pelvic Health and Rehabilitation Center. I am a past president of the International Pelvic Pain Society and past faculty for the International Society for the Study of Women's Sexual Health. Over the course of my career, I have cared for thousands of women suffering from pelvic floor dysfunction and have educated countless medical providers. I am also in perimenopause myself, and I am a daughter, a niece, and friend to many women who have faced these challenges. In our clinics, we treat women suffering from vaginal dryness, dyspareunia, bladder irritation, and recurrent urinary and vaginal infections, conditions that frequently overlap with pelvic floor dysfunction. Physical and occupational pelvic health therapists are trained to differentiate musculoskeletal causes from hormonal deficiencies, but our ability to help patients is undermined when safe, effective treatment, like vaginal estrogen, is stigmatized by inaccurate labeling. The current FDA labeling creates fear and confusion. It is shocking to me that the labeling for systemic estrogen therapy, which is physiologically different from local vaginal estrogen therapy, is actually in the inserts that patients receive. Patients read warnings that contradict decades of clinical evidence, and physicians, many of whom are already lacking training in menopause care, often tell women that vaginal estrogen causes cancer or other health problems. This is simply not true. Yet the weight of the FDA labeling and a physician's authority outweighs the reassurance of any physical or occupational therapist, no matter how experienced we are. This labeling is harming women's health, and it must be corrected. I also write to you as a daughter. Several years ago, my mother developed severe symptoms that were repeatedly misdiagnosed, or worse, undiagnosed altogether. It turned out that the problem was actually recurrent urinary tract infections. She was treated with rounds of antibiotics that destroyed her gut, caused weight loss, and left her debilitated. Despite seeing gynecologists, urologists, and primary care physicians, she was never offered hormonal therapy and was never offered vaginal estrogen. At the age of 70, and after months of suffering, she finally received vaginal estrogen under my advocacy. Within 1 month, all of her symptoms had resolved. She has thrived ever since, and yet even now she faces ongoing barriers. Some of her physicians, and she lives out of state, are still unwilling to prescribe it. Pharmacies have accused her of overusing it, which I can assure you is not the case. And the stress of navigating the system that has been shaped by misinformation has been exhausting. If I had not been able to advocate for her, I fear her decline would have continued. And outside of the recurrent urinary tract infections, at the age of 70, my mother has no other existing health issues. My mother's story is not unique. I see these patients in my practice every day. Safe, effective, low-dose vaginal estrogen restores the health and dignity, yet women are denied it because of misleading FDA labeling. On behalf of my patients, my profession, and my family, I urge the FDA to correct this error. Accurate labeling will empower women, guide providers, and reduce unnecessary suffering. As healthcare providers, we fight many uphill battles for our patients. Please make this one easier. Everyone deserves pelvic comfort and health and well-being. Please do the right thing and change the label. We at the Pelvic Health and Rehab Center are submitting our comments to the FDA, and we would like to encourage anyone seeing this post to follow the instructions in both our blog post and this Instagram post and make your voice heard with the FDA. This labeling is inappropriate and it needs to change. Thank you so much.